Hello, everybody. Periscope world. Hi, everyone. My name is Cheryl Putt, and I'm a licensed child and family therapist. I work in San Diego, California, and I'm in my office this Friday afternoon to talk with you a little bit about children who are experiencing anxiety. I actually decided to talk about this today on Periscope because I was talking with my daughter, who is 9, about Periscope, and she mentioned to me, "Mom, why don't you talk about my anxiety?" So I thought, well, that's a great idea. So basically, there are in my practice and just around me, I'm always seeing all kinds of children who are experiencing anxiety. Anywhere from feeling anxious about performance in school, feeling anxious about performance in sports. Those are the specifics, but a lot of times they're just general anxiety where they have no idea what is causing their anxiety. And it's frustrating because parents and teachers and other people around them don't understand that this is not something that they control. It's not something that they're trying to get attention for. It's not something that they are doing to get out of something. I mean, if I backtrack a little bit and say that, sometimes kids do, obviously, I have 2 kids, use excuses to get out of things. But when a child is truly experiencing anxiety, that is something that's actually interfering with their everyday life. What does that look like when a child has anxiety? It can be anywhere from being unable to make decisions on things to seemingly being fearful of things, kind of sometimes being what looks like lost in space. It means they're in their head and thinking all kinds of possibilities, unable to try new things, being worried about people around them, things happening, things that you know aren't possible, but it's there. For my daughter, I would say she's actually developed her anxiety, I think initially around eating and feeling fearful. She's a very healthy child, and it wasn't until she was maybe about 6 months ago, she's 9, where she had her first vomiting experience. And from there, I think her anxiety skyrocketed. And although when I look back now, it was present before that, but with that experience, I saw my child, who is typically someone who's very strong-willed, who's very confident, who's very capable, a lot of times fold into an inability to now make decisions on the simplest things. It's like she's worried that whatever answer she gives is going to be wrong. So this has been really hard actually for me, because I'm a therapist, and of course I work with children and adults who are dealing with anxiety. And so I actually decided to kind of work with her a little bit using my therapeutic techniques, and came to the conclusion that I am not the best person for her, because I need to be her mom and she needs me to be her mom as well. So we sought treatment with a therapist. But if your child is experiencing it, I think the biggest thing is to support them, to not necessarily believe in the things that they're being anxious about, but recognize it as it is their truth. You might want to get them into therapy to help them manage the anxiety, because typically it will only get bigger, and if left untreated, and will extend to other things if it's not specific to one thing. And just when it's actually happening, if a child is becoming really, really anxious over something, one of the main things that helps is to do some grounding exercises, things like slowing their breathing down, where you're breathing in 2, 3, out 2, 3, where you are having them, find something in the room that is a certain color, find as many things as they can as a certain color, because what those things do is gets them out of their emotional state and back up into their head so that they can calm down. The breathing, if your body is breathing slowly and breathing all the way through, it decreases the body's anxiety. And definitely to not belittle them, to not tell them that this isn't something you need to worry about, or stop faking it, or come on, just get what's the word I'm trying to say? This, just get on with it. What are you talking about? This isn't a big deal. To them, it's a big deal. And I don't know if there's adults out there who have experienced anxiety or who are currently experiencing anxiety. That it's something that you just have, whether it's irrational or not. You can't stop yourself. And actually, something I wanted to point out that I thought of recently with my daughter was that anxiety, I kind of likened it to a river. Now, I've never been river rafting because I'm not a good swimmer, but, a river is something that always flows. There's always a current to it flowing. And with anxiety, same thing. It's always there. So you will see people who seem like they have everything together on the outside, but on the inside, it's just raging. Okay. So the river is always flowing. Sometimes you can see the rapids up ahead. Sometimes they're small. Sometimes they're big. And you can sort of try to prepare for them or try to have things in place to deal with them. Other times it just pops up. And all of a sudden, you're just bouncing along, water's flashing everywhere, and you're feeling like you're going to tip over and die. And then at some point, obviously, because people still keep moving on, it will go back to just being that river. So that undercurrent that is always present. But the anxiety, the panic attacks, sometimes they just show up out of nowhere. Sometimes they're triggered by things, and you may know what those things are. So that's also something, is that it's not something that just goes away. If your child is just worried about something that's an event in time, for example, but the worry does not seem to continue on to other things or just always be there, then that's an appropriate amount of worry or anxiety that everybody feels. But when it's an undercurrent, when it's something that is constantly there, that's when it's important to seek treatment, because it can help children validate what their experience is. It can help children learn tools and techniques to deal with it. It can help children identify any triggers that they have, and also it can help you, if you're the parent or a caregiver or grandparent, whatever, how to deal with your child's anxiety so that it is supportive and not demeaning, even though you're not trying to put your child down. So I think that's all that I wanted to say about it today. I may pop on again at some point regarding children and anxiety, because again, that is something that I work with. I also work with children and adults who have experienced a trauma, who have experienced child abuse, and also those who are going through PTSD. So I hope that this talk was helpful for you. I wanted to encourage you to check out my Facebook page. I put an article on there. I believe it was 30 secrets people with anxiety would like you to know. And so I'm going to show you. Whoop, I should have done it backwards. Okay, if you can see that, it's www.facebook.com/Cheryl Putt LMFT. So that's CHERYLL PUTTLMFT. Not sure how to get that turned the other way around, because I can't write backwards. But anyway, go ahead and check that out. I read all the different comments on there, and very on point, and something to just kind of get you thinking when you are dealing with your child, yourself, or really anyone else who's experiencing anxiety. So once again, thank you for joining me, and I hope you have a blessed day. Thank you.